have applied for the post of research officer at CCRH. So please introduce yourself.
Good morning, sir. I am Dr. Radhika Agarwal and I'm from Delhi. I have done my schooling from Father Agmal School, Delhi, and I've done my graduation in homeopathy from the prestigious Nehru Homeopathic Medical College and Hospital. Thereafter, I've done my post-graduation from Baxter Homeopathic College and Hospital in Greater Noida. It is affiliated to Dr. B.R. Ambedkar University. I am also a recipient of CCRH Award for Quality Dissertation in Homeopathy during my post-graduation. Currently, I am a senior research fellow at CCRH headquarters, New Delhi.
Good. So as you told us that you did your PG from Baxter Homeopathic Medical College. So what was the topic of your thesis?
Sir, I've done my MD in practice of medicine. So the title of my dissertation was Usefulness of Robinia pseudocacia in the treatment of gastroesophageal reflux disease.
Okay. So the action or usefulness of Robinia, na?
Yes, sir.
So can you tell me the size of esophagus? How much means what is the size of esophagus? How much long it is long?
Sir, 25 centimeters.
25 centimeters.
10 inches.
In adult?
Yes, sir. In adult.
And in kids?
Kids, I don't know. 15 centimeter, I remember, but I'm not really sure about it.
And what is GERD?
The gastroesophageal reflux disease, and it is a multi-system disorder which affects the gastrointestinal system. And the main symptoms of this disease are the heartburn and regurgitation, along with the eruptions.
Okay. So it is kind of pathological or psychosomatic also?
So it is I would say both, because in most of the cases, anxiety and stress is the major cause for reflux, for acidity or heartburn. So it is a psychosomatic disorder.
Okay. And what was your sample size?
The 30.
30 was your sample size. Why it was 30? Means what is the justification to keep the sample size 30?
So like as per the discussion with my guide, sir, so we discussed for sample size 30 because like most of the MD dissertations, like it is more of a pilot study, so 30 was kept as a sample size.
So is it written in any book or any protocols that should be minimum 30?
No, sir. But this is like for the MD post-graduation studies. Like it can be in a pilot study, so 30 can be taken for such studies. Small scale studies we can take.
Okay. And what was the what scale you have used for the outcome assessment as a outcome assessment criteria?
Yes, sir.
Did you use any tool for that?
Yes, sir. So it was GERD questionnaire. So it is this questionnaire can be used for the assessment of GERD. So it can be used for diagnosis also. Like if we don't want to do any invasive procedure such as endoscopy. So in my dissertation, I have specifically chosen this tool because it was not invasive. Because most of the patients, when you tell them that you have to undergo endoscopy, so they have a fear or there is they are not readily acceptable to do that investigation. So that's why this questionnaire was kept for assessment also and for prognosis also. So that's for
And any other article you have written in your PG course or after your PG? Any article published in a peer-reviewed journal?
Yes, sir. So post my PG, I have done my senior residency from Nehru Homeopathic Medical College. So there, for the first year, I worked under COVID testing center and COVID health center. So there I published a paper along with the Nehru homeopathic professors also. So it was titled Homeopathic Treatment of Mild COVID Cases. And it was under home isolation. It was a retrospective and observational study.
So what was the outcome of the homeopathic medicine? Means you have used all the homeopathic medicines there. So it was the adjuvant therapy or pure homeopathic medicine.
It was actually individualized homeopathic medicines, but like the patients were, it was a mild cases, so patients were already taking paracetamol, that kind of allopathic medicines. But we
Hmm.
did not tell them to, discontinue allopathic medications. These were taken along with the homeopathic medicine.
Hmm. Hmm, hmm.
Three
So the
medicines.
other symptoms were improved, na? Other symptoms which were not covered by the paracetamol were also improved from homeopathy.
Yes, sir. Yes, sir.
Okay, okay. And what was the timeline of this study article?
So, sir, it was done for 2 weeks. The complete resolution of symptoms was seen for the 14 days follow-up.
Hmm.
And the main limitation of the study was that it was not a long follow-up study. So, like the cases of post-COVID cannot be traced due to this limitation of the study. Like the sequelae
Hmm.
of COVID-19 that cannot be traced.
Hmm. So what other articles did you read or did you study in your after this? Means did you study any other articles also on this COVID or
Yes, sir.
post-COVID scenario?
So, sir, for post-COVID, I have worked in post-COVID OPD also, and I have been a part of the post-COVID booklet, which was written during my senior residency. So, I've contributed to that booklet also. But the thing is that at that time, when we were doing the review of literature, we were not able to find any single article on post-COVID literature because maybe I think that was the time when COVID was still in season, right? So at that time, we were not able to find any post-COVID articles. But for COVID-19, yes, there were a lot of international and national articles. Like on Hong Kong, we have read that Bryony and Gelsimum were very useful for
Did
COVID.
you did you tell me the 4 or 5 articles name with the name of writers?
No, sir, I cannot tell
Oh,
that.
that should be no, you should write that now.
Uh,
That you should be it may be asked in the main interview because you
Okay,
should be ready with these articles and other kind of articles also like in on GERD also. Have you read any article like from the PubMed also from allopathic point of view also there may be some articles, है ना? And there may be some articles from homeopathy associated with GERD along with means
yes, sir.
besides your article also there must be some
Yes,
other articles also. So what is written in those articles? What was the outcome of or what was the conclusion of that article? So you
okay,
please study those also, है ना? So
okay,
because they may ask from these thing this area. And other thing I will advise you that you please study the research methodology properly, the whole research methodology. So you can answer each and every question of this from related to research. That
okay,
means if I am asking you what are the variables, so what you will answer.
okay, sir.
So what are the variables? Can you tell me?
Sir, in which for this COVID-19 study?
No, no. In research methodology, what are the variables? Different kind of variables.
So for variables like age, that can be one of the variable which can affect the
Yes.
study.
Yes.
Then like BMI can be there, weight can be there. So these kind of variables can affect, basically which are varying in the
Ha, ha. What
study.
what we are choosing for the prescription means
Yes,
what we are choosing till that what criteria which we are choosing till the prescription are the variables because there is age also symptoms also medicine also these are all variables, है ना? So basically you have to study uh, student like because they may ask the technical questions also from there.
okay, sir.
And which statistical method you generally used in your PG or your post PG means in your senior residency also. Hmm?
So you're asking like the name of the test, statistical test.
Statistical methods or you can say there's a different kind of method also, no? Like SPSS.
Yes, sir. So that was done by the statisticians. So that was done under SPSS
Acha.
and IBM, yeah, IBM
So
also.
that was done by the statistician.
Yes, sir. Yes.
So did you acknowledge in your article also that? done by the
Yes,
statistician. Okay,
yes, sir. Yes.
okay. Tell about that arsenic album, which was considered as a genus epidemicus in the at the time of COVID by the CCRH itself. So, what
Yes.
is your view about that arsenic album?
So, sir, recently I've seen the paper which was published by the CCRH team, and in that paper itself, they have concluded that it was beneficial for the patients who were given this medicine, and the percentage of people who contracted COVID, like who were given arsenic, were less as
Mm,
compared to who were not given.
mm. And since you have given, means we were in studies also in COVID scenario. So what were the medicines which were used in NHMC also? Most frequent medicines were.
So, sir, the top three which are listed in our this home isolation paper are the Bryonia, Alba, arsenic album, and pulsatile. These three were very
Okay.
beneficial, and chalcemium also. These
Mm-hmm.
medicines were very useful.
Okay. And this is the post for the research officer. So you may be posted in anywhere in India,
Yes, sir.
no respect of any that. So what you will prefer? Means what do we want to be, where do we want to be posted, or what will be your preference of posting?
So, sir, I am more inclined towards clinical research, and maximum opportunity for clinical research is under Delhi only, Delhi and Noida. So, because OPD setups are here only, like in Safdarjung Hospital, Lady Harding Hospital. So, and currently also I'm working at a dialysis center, which is again patient centric, and our research is focused towards chronic kidney disease. So, I want to be posted in Delhi due to clinical research opportunities.
And what are the qualities that you believe that our research officer should be, and that quality you inculcate in yourself, and you will be selected for that. So why CCRH will consider you as a research officer to select as a means a qualified candidate?
So I think for research, the cornerstone is that you should be open for any kind of quest for knowledge, because you can't be prejudiced that okay, like for example, Robinia, that you can't be biased that only carbohydrate or arsenic will work in a certain case. You have to have open mind that any medicine, be it, let's say, cantharis, which is used for urinary infections. It can be used for nasal, like sinusitis purposes also. So for this kind of research acumen, you have to be open for this kind of knowledge. You should have a lot of uh, lit, uh, like literature knowledge should be there, which can be accumulated through homeopathic books, the materia medica books. So I feel that I am suitable for this post because I am a regular reader of research articles online or the online journals. I've gone through a lot of books also, and so through the knowledge inculcated by my professors during my graduation and post graduation. So I feel that I have a platform where I can apply this knowledge, where I can see the results of homeopathy. Also, a very small example which I want to tell here, that presently I'm in a dialysis study. So for the first time in my career, I'm attending so many chronic kidney patients which I've never seen before during my OPD in my NHMC tenure or vaccine tenure. So now uh, the usefulness of medicines like eel serum, or let's say cuprum, or let's say arsenic album, these are very useful in this in the current 2 months which I've seen. So I think the knowledge which we have inculcated during our study, during that tenure, so it is coming into usefulness at this point of time, I think.
So you are updated with that point also, no? Because you are currently
Yes, sir.
seeing that the action of medicines. So you
Yes.
will be updated, means in comparison with anybody.
Yes, sir.
So and what do you think that if because in research studies or in research field, we always become the sensorial type of person. Means we
Yes.
always possessing a fault finding thing, because we have to critically observe each and everything, है ना?
Right.
So we more believe on that those things, that what is lacking and what is not functioning, or what, or why we are not getting the result from this and that, है ना, medicine.
Yes.
So our approach is different, where a clinician approach is very different, है ना?
True, sir.
Clinician always thinks about that our medicine is working, and we are giving results, kind of the opposite thing. So what do you think, a good research fellow or a good research officer can be a good practitioner or not? Because these things are two different approaches. They are two different approaches, and one cannot balance with these things, no?
Yes, sir.
Mm,
So, sir, the main thing which is in in line with which is in consonance with today's research is evidence-based medicine. So, be it like whether you are a research officer or you are a clinician, I think if you are giving evidence, let's say again, I would quote the example of dialysis. If the kidney function or the creatinine or the urea of my patient today is of X value, and after 1 month, when I'm evaluating the patient, if the value has been reduced, or let's say the quality of life, which is one of the objective of our study. So quality of life is improved within 1 month. So I think we have to evaluate the patient according to the parameters. Like we don't have to just go through the symptoms that what our organon is saying that only the symptomatically you don't have to assess. You have to consider both the mental and the physical. Both aspects should be considered in the homeopathic case taken. So I think even if you're a research officer, it's not like that only with KFT and with you quality of life. I will say that my patient is fine. You have to consider all the aspects and then you have to assess the patient
mm.
in this.
Means a balanced approach is required for that.
Yes, yes, sir.
Not thinking too negative, also not thinking too positive, also. In
Because
between, you have
also.
to be very vigilant about each and every case.
Because so like in this example, like just in 1 month, you can't say that your kidney patient is cured. And we
Mm,
cannot say
mm,
patient has been cured even if the
mm.
creatinine into normal range. Maybe after 1 month, KFT will become deranged.
No,
So
I am not saying about the 1 month. I'm saying that a person who is in research field from last 5 years or 20 years,
yes, sir.
means research field will impress or will affect his way of thinking, and
Yes, sir.
it may change the approach or my way of thinking. And as a clinician, if you a person who is practicing from last 15-20 years, the approach is different, totally different in the case of research and
Yes,
and
sir.
practice.
Yes, sir.
So that's why I was asking this. But anyway, you answered it, that you should be in the balanced way, है ना?
Yes, sir.
So that we cannot be biased, or we cannot be, means we can should not harm the patient also, as well as we should be very updated for that also, no?
Yes, sir.
And so I think you should study the all the articles very, means specifically, which is related
Oh,
to COVID also, and which is related to your studies also, parallel to
oh,
your studies like GERD and all those things. And side by
oh,
side, and like in Delhi, what diseases are most prevailing, in which area you are living, are there some diseases which are prevailing, so you have to study that also. And what
oh,
kind of articles on that disease are published till now, you should be aware. Means article, because this is the research
oh,
officer post. So you,
yes, sir.
as much as you can learn the articles, name of articles, and the author's name, primary author, secondary author's name, so it should be
Oh,
beneficial, because you can give the references also, no, on that. If
yes,
they will
sir.
ask any question regarding that, you can reference one, two, three articles. Say some articles are saying
Hmm.
this, some articles are saying this, because in every research the conclusion may be different. So you can
Right,
give the reference, and it will support as a evidence base also, no? Because you are saying, you are saying on the basis of some report, some peer
yes, sir.
reviewed journals. So it will give more impact in your answer. So
Okay,
try to
sir.
read more articles and more things which is related to research. So that
Okay,
would be
sir.
better, है ना? And the practice
Okay.
of medicine, likewise in GERD, you should study the GI also. Means the practice of medicine GI portion you have to study all. It is not that they will only ask esophagus or anything. They may ask the functioning of the GI also, related to liver function also, all things. So from anatomy,
Okay.
physiology, all point of view, you should study that, है ना? But anyway, you are going means better and better and better. And from last 1-2 interaction we have already done regarding other posts. So you seems better than before, and you are pretty confident in this interview. So
Yes.
still a lot of scope of improvement, and you have to work on that. But
Sure.
it will means it is a good interview, I can say, for the assessment,
Thank
है
you.
ना? तुम improve कर लोगे उसको. But
ठीक है
anyway,
जैसे मैं
कॉन्फिडेंस तुम्हारा बूस्ट हुआ है पहले की तुलना में. और
ओके सर.
मतलब बस वही बात है ना कि कंटेंट बहुत जरूरी है. आप कोई भी
ठीक
आर्टिकल बोलो, कोई भी बोलो, कि आपको टॉपिक याद होना चाहिए, चाहे रट्टाफिकेशन से याद हो जाए.
ठीक है सर, वो मैं चीज मैंने नोट डाउन कर लिया सर. सी द
हाँ.
आर्टिकल्स जो कह रहे हो एंड द
हाँ.
ऑथर, वो मैं करती हूँ.
और कुछ सीसीआरएच के बारे में भी पढ़ लेना. सीसीआरएच का एस्टेब्लिशमेंट कब हुआ, सीसीआरएच आप
यस.
नौकरी करने आ रहे हैं, ठीक है. अभी
ठीक है.
करंट आपके कौन है, प्रेसिडेंट है, जो भी हो, जो भी देखते हो, हेलीकॉप्टर करते हो. और प्लस आपके किस मिनिस्ट्री के अंडर में आता है, वो मिनिस्टर कौन है, वो थोड़ा बहुत
ठीक.
जियोपॉलिटिकल एक थोड़ा-सा होता है ना, कि आप थोड़ा-सा आपको नॉलेज है, अगल-बगल की भी नॉलेज है. कितने तरीके की
ठीक.
स्टडीज़ अब तक सीसीआरएच कर चुका है, किन-किन फील्ड्स में कर चुका है. मतलब आपको एक्स्ट्रा करिकुलर सीसीआरएच में भी थोड़ा-सा पता होना चाहिए. तो उस
यस.
तरीके से आपको बोलना है कि भई आप कैसे उनको इम्प्रेस कर सकते हैं. और अपनी अपनी नीड दिखानी है कि भई आपको क्यों ये जॉब चाहिए, क्यों ये ज़रूरी है. इसके बारे में थोड़ा-सा आपको वो बताना होगा, है ना?